Let's start with one of the most common toxic dental materials, and that would be mercury amalgam fillings. Now, sometimes the name silver fillings is put on them because silver sounds prettier and sounds nicer. Many people are aware that mercury is a toxic substance. It is, next to radioactive materials, it's the second most toxic substance element to humans. And so mercury amalgam fillings are minimum, each filling is minimum made up of 50% mercury. Now, then the various different formulations might have copper, tin, silver, or zinc, just based on how the company made them that year. And so for decades, if really anybody questioned the wisdom of placing this toxic material into the mouth, they were told, oh no, it's completely safe. The mercury, once it's mixed with those other metals, becomes completely inert. It doesn't escape from the filling. It's completely safe. This is actually a position paper. This was, the position statement that's on the ADA website. This was current up until not too long ago. I have the date on here is November of 2021, but I just went and looked again last night. They now have a little disclaimer that there is some controversy over this, so that, hoping that we're starting to move in the direction of just acknowledging that maybe we should at least move towards not placing mercury fillings anymore. But the problem is that they aren't safe. They are durable. Mercury fillings can last for a really long time, but they aren't safe in that we know that the mercury comes off of these fillings. And there's lots of research that shows this. A couple of examples would be, and I don't think this will play for us on this shared screen, but this is the smoking tooth. If you go to Google and you Google the smoking tooth, you will find this video and you can actually watch it play. Those are two fingers that are holding a tooth there. And in that tooth is a mercury filling that was placed 25 years before the tooth was extracted. And what they do in this video, it's in front of a phosphorescent screen. They rub that mercury filling with a little pencil eraser just to mimic what the forces would be, the friction from chewing. And then you'll see as they wave it in front of that screen is this vapor, and that's measured with the gerometer. That is mercury vapor coming off of that 25-year-old filling. So we know that comes off of there daily. So you can imagine whether you have one filling or whether you have 20 mercury fillings, you're getting a daily dose of that in your mouth. Another study that demonstrated this was this called sheep study. They decided to place 8 mercury fillings in the chewing surface of these sheep teeth. And then they went 30 days and let the sheep just eat like normal. And at the end of those 30 days, the sheep was sacrificed and these radiographic studies were done. So when you're looking at this, kind of orient yourself. On the right side of the screen is the sheep's head, and you can see the black is where those fillings are. They were marked with radioisotopes. And on the left side is the tail end of the sheep. So after these 30 days, you can see that mercury has now found its way and really is concentrated in the gut, the spleen, the liver, and the kidneys. Now, there were some people that were a little skeptical of this study and said that what couldn't be true because sheep don't chew like humans. So they recreated the study in monkeys, got the exact same results. So these are just a few of the studies that show us that this comes off of those mercury fillings. So let's talk about mercury toxicity. Fillings are definitely not the only source of mercury in our environment and in our exposure to mercury, but they can be a very big contributor to that. So we know that mercury has an affinity for nerve tissue. It attaches to red blood cells and can diminish their oxygen carrying capabilities. It can cross the blood-brain barrier and it can cross the placenta. And there are certain gene types, some people, I have patients that I've had in my small town for a long time that are walking around. They've got mercury fillings. They have no apparent systemic issues. It doesn't mean that mercury is okay for them. It just means that their body's doing a good job at getting rid of it on a daily basis. Where certain gene types, or sometimes when your immune system reaches a certain point where it's just not functioning properly, you have a harder time eliminating heavy metals like mercury. So it causes them to accumulate in the tissue. So let's talk about, though, once again, from a I showed you some scientific studies, but from a logical standpoint, that they've said for a long time that it was okay to place these mercury fillings in the mouth and they were completely safe. However, the EPA has regulated, our Environmental Protection Agency here in the States has regulated these. They know that mercury is toxic. They don't want that in our landfills or in our drinking water. And so anything else that I use or that I take out of the mouth, I can pretty much throw in the trash can, or it can go down the drain. Mercury, however, it's mandated that when we take out pieces of mercury from a filling, we have to save that to the side and put that in a biohazard jar. So they're trying to tell patients that it would be okay in their mouth, but as soon as we take it out, we're going to need to put that in a biohazard jar. And that just logically doesn't make any sense. We had this long before it was mandated, but we are now required to have certain filtration devices on our water systems so that it protects any that you get in your suction from going into our water sources. So it's just one more little lack of a connection there, that to say that it's safe and then be able to say it like